Hello, I'm Dr. Greg Winteregg. I'm a dentist and a partner at MGE. And for this week's tip of the week, I'm going to break it down into two parts. And what I want to talk about in these two segments is the doctor and the hygienist coordinating treatment on an existing patient. Now, I was in practice for about 13 years before I became a client at MGE. And I can tell you for my own self, it's real easy to fall into a bad habit of here comes a recall patient. They've needed a couple of crowns for 5 years. You already know the words that are going to come out of their mouth as far as objecting as to why they're going to get that done, or as to why they're going to resist the scaling and root planing, or whatever the treatment might be. And before you walk into the treatment room, you're objecting for them before you even tell them again, this is what they need. So step number one for doctor and hygienist, and this has to be coordinated as a team, you need to treat every recall patient like a new patient. Now, that does not mean you have to do a 30-minute exam, etc. But I'm asking you to take a new viewpoint. Look at this mouth as if this was a new patient. And in that regard, sometimes new patients are easier to do the examination on because you've never met them before and you're just telling them what they need. Then you'll get into objections and such which need to be handled later. I'm talking about taking a brand new viewpoint on this recall patient and don't put the objections there for them. Okay, so you can prepare for them, you know what they're going to say, but why not just look at the patient and say, listen, if you were a new patient, this is what I would tell you. This is why you need this. And so, first of all, the doctor and the hygienist have to have a willingness to look at every patient like they're a new patient. And you have to be willing to persist through the patient's stops and barriers. You've heard other videos that I've done. The rule at MGE is tell them at least 3 times what they need before compromising. So, that's my tip of the week for this week, part 2 next week. See you then.